Hello, and welcome to another episode on the Move, Talk, Thrive podcast. Today, we are unpacking something that has just really captured my attention since Emily brought it up. It's the whole notion around support and see rather than the old wait and see terminology that we used to hear from GPs. I cannot wait to share this episode and for you to hear what we talk about today. Let's get stuck in.
We are child development obsessed business besties and mums, and we're here to spill all our secrets.
We have a combined 30 years experience working with children, and each episode we will bring you up-to-date research and evidence-based strategies to set your children up to thrive.
I'm Lizzy Dawson, Australian exercise physiologist.
I'm Emily Mackie, Australian speech pathologist,
And this is the Move, Talk, Thrive podcast.
All right, I'm excited about this one, which I say every time, but yeah, such an important topic. And I think it's something like as soon as you said it to me, Em, and we were just talking about it, I can't actually remember when you said it, but I was like, oh my God, I love that. And I've shared it far and wide and everyone loves it. Support and see.
It blows my mind. Support and see. I'm like, it's so basic. It's so like you think, oh my gosh, this is so, of course we'd do that. Of course we'd support and see. But I think you mentioned that traditionally GPs would say, wait and see. Yeah. They're still doing that. That's not like in the past. In fact, just this morning, I was talking to one of my clinicians. In our clinic, we have therapy planning time. So one of her questions was, she'd just done an assessment on a child and had recommended that the child have therapy. This child had came out with moderate language difficulties. Mm-hmm. And then the speechy then recommended that they go and see a pediatrician as well, because she wasn't sure if there was anything going on developmentally. They went to the pediatrician and the pediatrician said, oh, no, the child's still really young. Like the child is probably like 20 months. And the pediatrician said, oh, just wait and see. And so because of that, the mum called up today and was like, I'm going to cancel the sessions. The pediatrician said to wait and see. And my speech therapist was like, no, you need to access therapy. So it is something that is actually very prevalent and has happened today in the clinic to us. And so it's a very simple message, but it's so important that we talk about. And it's so important that we are supporting and seeing, not waiting and seeing with our clients. And we want to unpack what that statement means to us and what that would look like on a practical level.
So I've got two things here. One, I feel like from a parent's perspective, it's almost reassuring to hear the words wait and see, because you're like, oh no, they're going to be fine. Like this is, they're going to, it'll just come out in the water, like it'll be fine. Like I just think about, my son and his speech stuff. And if I had heard, oh, we'll just wait and see, he'll probably grow out of it, I would have been like, oh, cool, awesome. Rather than, oh, let's get him into speech and the unknown and just going, oh, what does that involve? Like, is this going to destroy his confidence? It's uncomfortable, right? So I feel like that's a really big part of it and something that needs to be addressed and really taken, as a practitioner, understanding that mindset of a parent and being kind in the way or taking that into account when we're having the conversation. And the other point is that it's frustrating because we know that early intervention is key in helping children. Like these poor little, really concerning. We know that 1 in 5 kids are starting school developmentally vulnerable. And the reason that we're capturing that is because all the testing is done by like in school level, and we could have been addressing this when they're in childcare in those early years. And I just found a really interesting stat, and it was that Australia, so this is from where is it? The Kids Research Institute of Australia. They did a report, and the report found that late intervention services cost Australia governments $15.2 billion every year, a bill which could be avoided if help was provided sooner. So I
Whoa,
think
that's like mind-blowing.
mind-blowing. Hey,
That is such a huge amount of money.
yeah. I'm just reading it. The first major national study into the benefits and opportunities of early intervention has found getting in too late to provide help to at-risk families and children costs Australia $15.2 billion a year, known as the cost of late intervention.
That is scary because why? Well, what is classified as late intervention? But we all know as allied health professionals that early intervention is key. There is so much research that shows that, and that's the premise of the NDIS, right? The premise is that children with early supports are prioritized, they're given the funding so that they can get on top of these difficulties, or at least get the support and see approach to prevent. Like it's prevention rather than being reactive. So that is really, really scary. Really, really scary. But there's so many layers to it. Like you alluded to, there's so many layers as a parent, there's so many layers as a professional of how we go about this, of how we go about supporting and seeing. And then, so it's one thing to address this with your clients, in your practice when they come in. It's then another, so, you're educating parents and getting them on board. It's then another thing to look at other professionals and address the other professionals. So like this pediatrician, like I said to my speech this morning, like we either don't refer to that pediatrician anymore, or we have an educational chat with that pediatrician if you think that person is open to receiving new advice. And sometimes that can be very difficult, or it can be daunting, but it can be very difficult if you've got pediatricians or GPs who have been working for a very, very, very long time and are not really open.
So I think you try, right? And if you try and it doesn't work, then you don't refer.
Yeah. But wait, I mean, like, yeah, you just don't refer, right? So it is important that each practice has a list like that. But really, like, why would you let your child struggle? Why would you let them flounder? Like, why would you wait and see? Wait for what? Wait for them to get worse?
Yeah, wait for their confidence to be blown.
Really,
so
when we say
here,
wait and see, why would you do that?
It says here, research shows the first 3 years of a child's life are crucial to their development and provide the foundation for a happy, healthy future.
Exactly. And like that is on the website, or the web pages for anybody to read. And the good thing is that parents can access that, but sometimes it just freaks them out even more. But I think like I don't know about you, Lizzy, but when I would be in the role of a mum and I would take my children to pediatricians in the early days, and Isabel had issues with her hips, so we had to see lots of different specialists. Evie had allergy issues. They would make me feel like a worrywart. They would make me feel like I was being over the top. And I felt like a lot of them, pediatricians and the specialists, were very dismissive. And I found I had to advocate quite heavily for myself. And I feel like being a speech pathologist, being a bit older, as I'm like, I wasn't 20 or 21 having a child. Like, I think I was 31 having a child, like, and I had run a business, so I had a few life skills under my belt. I felt like I could advocate for myself. But I also then in that moment, I was like, what about all these mums that can't advocate for themselves, that don't, haven't worked with children before, that don't know much about children? They then just sit with these feelings of feeling like a worrywart and feeling over the top. And then they go, oh, it's me, like I'm being, I'm the problem here, so I will just wait and see. But that is like the first key, that us as professionals is we need to empower mums to advocate for themselves and let them know that they are the best person in knowing their child. They should follow their gut. If their gut is telling them, even if they have no experience with children, they know their child. They've, been responsible for their child from the first day that they were born. and they know them. And that is like the biggest, most solid piece of evidence that we should follow when we're recommending therapy or if they're saying something's wrong. So I think the first key is empowering mums. I feel very passionate about that after being through that experience myself.
Yeah.
And then encouraging them to educate themselves and I guess keep pushing. Like if someone dismisses you, keep pushing. Go and see a different professional. Go and see a new GP. Go and ask other mums what they're doing, because mums don't know that the first 3 years are critical, and brain development is so critical in those 3 years. There's so much research coming out about it now. We have to support and see. We have to.
Yeah. So what can we do about it? Where do we start? I mean, I guess it's, if you got a parent bringing kids in, because I think it's quite easy to label mum, I'm saying mums, but, like as anxious and whatnot. But really, we really need to be encouraging it, don't we? And we can all only do our little part of it. And I think it's to encourage people. And I think, health professionals probably struggle with it because we struggle to, it's been drilled into us to clinically justify our sessions. That's that's my experience. And, advocate for funding and whatnot. So it's kind of feels uncomfortable, I would say, for health professionals to say, you know what, the child is going to benefit from coming in regardless of, a diagnosis or, anything extreme going on. And that's what I always say to my team. Like, if you were to provide, like, take money off the table, if you were to provide the best service you could for this child, what would your recommendations be? So not like, what would this person want to pay or how much would they want to bring in your child? If you are going to get the best results and you are going to set this child up for success, what would you recommend if no one was paying anything and money didn't exist? Because I think that's something that we really struggle with.
Yeah. Do you think it's the money component that it is?
I think health professionals really suck at asking for money.
No, yeah, but that's why people then feel like uncomfortable saying like, oh
so.
yeah, I think you should have an assessment or go to that service. Do you think it comes back to money?
I think it comes back to worth and confidence in ourselves. That even if we like truly believe in what we're providing, I think it's that like imposter or that confidence piece of and self-worth.
Yeah. Well, two things there. Imposter we're going to have an episode coming out with Alana Nichols, which smashes that sort of
I know, I
mentality and that word. So we'd
have to listen to that if you haven't listened to it.
Yeah.
Or do listen to it when it comes out.
Yeah. And then I think that
but do you agree?
Yes, I do. I do. And I think it comes back to knowing these statistics, right? And knowing the importance of it. And that why has to override all of the insecurities, because really you've got to think about like children that then haven't gotten help and haven't floundered. And that's my motivation is I'm like, well, I actually have seen the flip side of children who haven't gotten help, whether that be, just in my personal circles or in professional circles as a speechy. And those children, they come in and there's so much mental health there because they've had to sit there and not understand it or sit there and struggle. There is so much attached to that. And that is what drives me. I'm just like, I do not desire to see any child sit there in this struggle day after day after day, like if we're talking about at school.
Yeah.
And just made to feel like less than what they are. And so we have to just be reminding ourselves of the why, like why we do what we do. And I think, it comes down to actually having that conversation with them and going, okay, well, what's realistic in your situation? Like, we are very privileged to live in a country where we do have lots of different options. Sometimes it feels like there aren't options, but compared to Asia or Europe, there are loads of options that we have in Australia for parents to access healthcare. You may have to wait, but you can access. So it's looking at then going, okay, like it's just having the conversation and going, what would work for you with your situation? And, would it be public health? Would it be a community service? Would it be there's lots of different services that we have locally, like Life Start or early intervention preschools or government services, or is it going to a private practice? Is it using the Medicare rebate for 5 sessions and piggybacking that over fortnightly sessions? Like, it's getting really creative in how we provide that support to parents. But that
Is it
is actually,
upskilling ourselves as parents? Like, is it
yeah,
parents upskilling,
yeah, upskilling parents. And often that is then that is what parents really lack. And that's a huge barrier for them. Like you said, it's a barrier for us as health professionals, sometimes the finances to bring it up, but then it's a financial barrier to parents accessing. And it's going, actually, no, did you know that you can get a Medicare plan if your child has 2 or more conditions, which often, as children that come to speech pathology, it's hearing and speech. Did you know that you can get a Medicare plan for 5 sessions
Does
for
it
a
have to be?
year?
I don't think it needs to be 2 or more conditions.
Yeah, it's got to be like they've got to have quite significant issues,
Mm.
two or more technically on the paperwork, or two, not 2 conditions. Sorry,
Isn't it
they
just
have
a
2
chronic?
professionals
Medicare's
involved.
just chronic, so it's. I don't know what I don't know with kids, but I know for exercise physiology to get a Medicare plan, it's just needs to be chronic, so it's 6 months or more.
Yeah, and then they sort of say 2 professionals or more. If your
Oh
GP is being
yeah,
a
two
real stickler. Sorry,
professionals. Yeah,
I should
okay.
have said 2 professionals rather than 2 conditions. Yeah.
Yeah,
Um, but like, a lot of parents don't know about that Medicare plan. And so
yeah, I
it's then
know.
educating them, and then it's educating them how they use it. And so I guess when we're looking at the research and what is ethical to recommend, this is something that has to be, like, when we're looking at evidence-based practice, this is something that we have to consider. What are our service constraints? Because everyone has a different service. So, if you're in private practice and the parents got funding, well, you can see that child weekly endlessly. So you can divide your goals and your therapy plan around that. However, if you've got a parent coming in or a single mother coming in and they're saying, like, I'm using the EPC plan, I've got 5 sessions, can I make them fortnightly? Can you give me, the maximum amount of work in that time that I can do? It's working in the service constraints. But when you
Mm,
consider that then becomes part of your evidence-based practice, and you look at the research for different ways that people have implemented therapy with different service delivery models.
mm,
And just an example, like, I did this in my working webinar, which, if you want to look at that, it's on my website. Working webinar, I'm going through the PLA goal selection guide. I was talking about how language therapy, depending on the type of difficulty and what area you're targeting, it can actually be more effective for children to have spaced out therapy rather than weekly therapy with
mm.
language difficulties. If you've got the right key ingredients in your therapy sessions, you can actually do, like, 1 session a month, space it out, but they might be 60-minute intense sessions. But if you know the research around that and you're educating yourself, then you can actually work with the parent to be like, I will see you, and work with this Medicare plan. If finances are the issue, and it's being
Yeah.
creative about how we approach our service, but knowing what the research says as well, which with language, it is
Mm,
flexible. Different areas, different research.
yeah.
But essentially, support and C can look different, I think, for
Mm,
different conditions, different populations, but it's just an overall statement. We're not waiting and seeing if a problem develops, we're supporting and seeing. So we're having an active
yeah.
role with the parent or the child.
Yeah.
We're doing education, like we spoke about. We could even do parent coaching. I don't know, do EPs more do that coaching element where, like, what it would look like in speeches where, like, parents might come and we might do like an hour session at night with them, and we might say, like, these are the things that you can do at home,
Yeah.
research based, to help your child start speaking, and then they go and do that, and then come back, like, maybe, or we might even do it like over 4 sessions, 4 nights, and then go
Yeah.
away. Do you do things like that?
Yeah, we definitely do. And I do. So I actually do sessions for educators. So I go into education facilities and do staff development ones, which would be very similar to what I would do with parents. But there's so many options, isn't there? Like I've got my online program. So we give our online program to all kids that are coming through our doors. So they get a subscription to the online program so that they can get that frequency, because I think the frequency is the key, isn't it? And that's, you're not going to get that even if they're seeing you weekly. You're not going to get that kind of frequency and that repetition that's needed. There's always going to be things that they're needing to do at home. So it's like, it's just about reframing it, isn't it? To support and see how can we support them. And if there's, if there's barriers, how can we still support them? So for us, if there's cost barriers or location barriers, the online program is perfect. And I've got a free sample of that on my website, which we can link to as well. So, there's so much out there, like even just jumping on social media, I think there's so much out there now. And I think it's just about reframing it and being aware that wait and see is not going to help anyone, is it?
No, we don't want children to sit in that struggle. And mums as well. Let's talk about what, I don't know if you've ever had this, but whenever I'm socially out, or if people meet me for the first time or anything like that, people always ask me, what do I do? And it's the same conversation. I say, I'm a speech therapist, because people think speech pathologist. They think pathologist is doing something with blood. So they go,
Yeah.
so I say I'm a speech therapist. And then they say, oh, are you analyzing my speech right now? And I'm saying,
Ah,
no, I'm no. But then on the other flip side, like I have them mums saying, oh, do you think my child needs speech therapy? Like people respond really weirdly, not weirdly, they get a bit paranoid. Like it's like when I tell them I'm a speech therapist. So, and it's only because
like
I asked, like,
me taking photos of my child's writing, and I'm like, Emily,
yeah.
is this where you should be at? What should I do?
Yeah, but you and I are friends, right? So that's fine. But
Yeah.
I find it very sometimes hard when, so like if a child is fine, like, that's fine. But if a mum
Mm.
does ask me like off the cuff, they're like, oh, what do you do? I'm like, I'm a speech therapist. And they're like, oh my gosh, my child does this and my child does this. What do you think? Like
How do you respond?
that can be a bit overwhelming. So what,
Yeah, because it's like, where do you start? Like, what, like,
yeah, yeah. Well, I
mm,
mean, obviously you can't give a professional recommendation without doing an assessment or anything like that. But I think what I tend to do is I just tend to deflect it. Like, and I will say, I don't give any professional advice, but I would
yeah.
say, oh, like, are you concerned, or what are you concerned about? Because often they'll be saying, oh,
Mm.
preschoolers said this and preschool said that. And I mean, that's what you said, Lizzie. You were like, school said this about Flinny's writing. And
Yeah.
so I just say, well, are you concerned? Have you noticed this? Like, is this
Yeah.
typical for your child? Are they the same way at home as they are at school? Are
Yeah.
the person reporting this? So they're like, I think asking very open-ended, non-judgmental questions are really good for parents to have that air to just, or sometimes they need psychological air just to
Mm.
talk about it. Talk about it with someone who is a speech therapist or an EP,
Yeah.
but just asking open-ended questions. And I think, like, I would then say, have you noticed that this is really impacting them, like in your day to day when you're trying to get things done with them?
Mm.
And, is it impacting you practically, like functionally,
Mm.
like has it, if I've got the girls on activity, so we're doing ready, steady, go, I'll say, like, when we're at ready, steady, go, I'll say, is it impacting them here? Like, is it impacting
Mm.
them while they're doing these things? And they'll say, oh, yes, or, or no, or whatever. But,
Yeah.
you're sort of still just asking probing questions. In this whole time, I haven't actually given any recommendation. I haven't said anything
Yeah.
to the parent.
Interesting.
I'm
Yeah.
just letting them feel heard and feel
Yeah.
seen. And then I
And
think,
not down, like, and not, I think it's, it's part of that support and see, isn't it? It's about not minimizing it or not making them feel anxious. It's about making their feelings and thoughts valid. And you're just giving them space to
yeah,
feel that.
yeah,
And you're asking questions to help them identify the next best thing to do.
And that's literally then what I would do. So then I would say, well, if you're really concerned, like I can hear you saying that you're so concerned, then, you probably should go and see a speech pathologist.
Yeah.
Or,
Yeah.
if they're then not talking about it, I would say, well, if you're not concerned, you need to do what you feel is right for your child. If you do want to see a speech pathologist, I can give you the names and numbers of some wonderful people in the area, or you can look on the website for speech pathology in Australia and find someone. But it's really up to you. But if you are worried, I would recommend that you go and, this is what I say, if you are worried, I would recommend you go and have an assessment anyway, because if the speech is not concerned, they'll just tell you that you don't need help and that they're on track.
Because what harm is it, right?
Yeah. Whereas if they actually do need help, then you can get them the help that they need. But we don't want to be seeing children that don't need the help. Like, we're not going to tell you therapy and you don't. And I think that's often a lot of parents' fears, which it was very unfounded. It's like, oh, well, they're going to tell me something I don't want to hear. And it's like, no, if your child's fine, we're going to tell you they're fine.
Yeah.
And I'm like, well, what parent doesn't want to hear that, right? What parent doesn't want to hear, oh, your child's fine, like keep going on your journey, So I think that doesn't need to be like, when you're recommending, it doesn't need to be weird. You don't need to do it formally. You just be yourself. You just give a recommendation, and you can just say to them, oh, do you want a recommendation for a speech pathologist, after you've given them that time to speak? And, like, then I might say, can I get your number or something, and I'll give you some or write them down for you or whatnot. Or I might just give them advice and say, like, go to Speech Pathology Australia website and type in your area and it will come up with local professionals. I mean, that would be the same for you. Do you have a database or something?
Yeah, we've just got ESSA website, which has got a list of practitioners that would be able to help. And I think another important, I guess, line of questioning or curiosity is if they are getting support and maybe don't know if they're getting the outcomes that they want to be getting, or maybe they're wanting support and they haven't yet done it. What are the obstacles around it? And you might be able to provide some insight into how, your profession might be able to help them. Or for us, there's so many different things and ways in which we can help with someone. So it might not just be gross motor, it might be regulation, or it might be, cognitive development or social emotional. And there's so many ways in which we can help and partner with other health professionals. So I think it's just about, I guess, being confident in ways that we help children and just identifying what roadblocks they might be having in terms of seeking that help.
Yeah. And I think, like, one of them, probably the biggest roadblocks, would be mindset.
Or maybe their doctor is saying, oh, just wait and see.
Yeah. Yeah. And so I think the main thing to realize is that we know that support in C is the best, but just because we know that and we agree with that and we do that doesn't mean that everyone else will think that. So I know that, as I think we did an episode on this about, like, having empathy and compassion. You do, like, I've had multiple situations with mums where the child has an issue, they will talk to me about it, and then they'll just do nothing about it. And I do get really frustrated about that. But as my husband always reminds me, that I've done everything that I can and there's nothing else I can do. And I think now you have to recognize, like, the other person, the other parent. And I feel like parents have to be in a place of either desperation, and they're in a place of desperation because they know the functional impacts. And generally it's like the child's starting school in 6 months, or the child has had a major incident at preschool, and that has really led them to see the functional impacts. But that's something that's completely out of our control. People like to ask questions and ask for information, but that doesn't necessarily mean they'll do anything about it, and you've got to let it go, and you've got to be okay with knowing that you've done as much as you can in that time. So it's about educating people and, like, following that script, giving them some time and chatting, and then giving them the recommendation. If if that's what they're all asking for, but then just being okay as well, because you can't control anything but yourself. So you can't control whether they follow through or they don't.
Yeah.
And then I guess
Yeah.
it's just waiting. Like a lot of the times with me, it's been people that we know quite well. So we see them over time and it's just waiting, and then they'll keep having conversations, and then they might hit another roadblock like you're talking about, and then they'll come back and have another conversation, hit a roadblock, and it's just going, everyone's on their own journey. I keep encouraging them, and that's all I can do really at this point. Like, if you're coming up with parents or knowing people that have those roadblocks.
What about what
Yeah.
do you do? Because I don't know many speeches that don't have a wait list,
Oh,
or
yeah.
OTs that don't have a wait list. So
Yeah.
for us as EPs, I mean, this is kind of like a strategy for us where like we don't have wait lists because we're not as in demand as you guys are. We're also not as well known for pediatric services. So we try and team up with other allied health professionals and say, look, if you've got a waiting list, we can at least get kids in to see them we've got skills in and around. We are not speeches, we are not OTs, but we've got skills that are going to help children holistically develop, and also can act as a like a screener in regards to if there's clients that are quite urgent. That's something that we can then report back to the OTs that we work with as well. But in terms of what you guys are doing, there's wait lists. So what do you do then?
Well, I always just say to them, like, there is waiting lists. And what I tell parents to do is, if you're concerned, you may as well put your child on the waiting list, because you're not going to have to access therapy anyway. And then you just sit on that waiting list for however long it is. And then you make the decision when the child has the opportunity to come off the list. So, but in that time, the child might have developed. Great. You just say, I don't need the service anymore. And that's generally all community health centers as well. Like, you have to sit in a waiting list if you go public health. And then I say to parents, but you would rather put them on a waiting list now rather than sit and wait and see. And then in 6 months' time go, oh, no, I'm 100% sure they need therapy. And then it's like, well, now you need to wait for another 6 months when you could have already been waiting on the list and you could actually be having therapy. So I always do say that. And then I think because of waiting lists, I recommend parents to lots of different resources and like different apps or programs and things like that. And I sometimes find that parents are way more open to purchasing one of my busy books rather than actually putting their child down on therapy or accessing therapy. So again, I think that's another little thing you can do. I don't know if there's resources for EP type stuff, but definitely with language, I'll recommend my busy books, which I've written. We'll put the link in the show notes, like where you can see the busy books that I've written there for language. And I've also collaborated with my creative box that's due to come out, which is a little craft box that we have, which has speech therapy information in that and tips that they can do to improve their child's language skills. So little things like that. Obviously, I always say go to my Instagram, Emily Mackie Speeching. I've got loads of tips on there, and you could do that with your Instagram too.
Yeah, absolutely.
So I find that sometimes it's a real journey for parents. Like, they have to buy the resources. They have to be on Instagram for a while following me. They have to then get some of my freebies. Then they have to, have another chat with me.
They need time to trust, I think.
Yeah. And it's relationship, right? So again, you can't control the process as much as we want to get children in as quickly as we can for help. I think.
So I think a key message there is to have different options as an allied health professional, have different options, resources, entry points to your services. So you've got a bunch of resources, the busy books, the creativity box, and your courses.
I've just got my ebook for parents too. Yeah.
Yeah, amazing. And I've got a baby development course. I've got my online programs. I've got a mindfulness script. There's lots of different ways that people can access what we're doing. And I think that, that gives people a different entry point into your support services. So I think for allied health professionals, what resources can you be developing for parents to build the trust to get to where we need them to get so we can have that big impact on their child? When I kind of struggle with it, I try to connect emotionally, like what pulls on my heartstrings. So when I'm like, oh, I don't want to put myself out there, I think about my kids starting school and, they're little sensitive Flinny with his chubby cheeks. And like, I just, like get really emotionally attached. And I'm like, why would I not do everything to help children access that? So if I'm struggling with putting my online programs out there or, a free resource and I'm like, oh, someone might not like this or whatever, then I think about my kids and I think about those statistics of 1 in 5 children starting school developmentally vulnerable. If you have had a child start school, that cannot not pull on your heartstrings. Like it's so intense for them. So that's what I do to kind of really connect with it and just go, put it out. I'm just going to keep putting it out there and, support in whatever way I know.
That's it, really. That's it. It's putting aside that for the greater good. So in a nutshell, wait and see is out, support and see is in. And support can look different for many different children and very many different professionals. However, we really need to be challenging that if we're hearing parents be giving that advice. If we're hearing parents do that themselves, we need to be saying, no, how can we support you? We've given you some practical questions and things like that you can ask. We've given you practical resources, having a bit of a mindset into understanding parents and just educating the industry professionals where possible, educating parents, speaking about it publicly, and really trying to have that vision of getting early intervention for our children, because that will change the world. That will change their world and it will change our world. But yeah, we hope you have enjoyed this episode. We'll put all the links in the show notes and we'll chat to you in the next episode.